All right. Good morning, everybody, and thank you for joining us today. I'm Cheryl George, your host for today's session, and we are here to discuss tobacco cessation solutions with Pivot. For members trying to take the lead in managing their health, quitting smoking may be something that they have tried for years or decades even to accomplish. And Pivot offers a modern solution that empowers members to create enduring behavioral changes that last. With a mission to combine science, technology, and compassion to improve health one human at a time, they have successfully changed the game for tobacco users. We have been working with Pivot since 2020, serving nearly 8,000 fully insured members in achieving their goals of being tobacco free. And thanks to the success we have seen, we are expanding that program to balance funded and self-insured employers starting in January. Before I jump into today's agenda, just a few routine housekeeping items to note. This webinar is being recorded and will be provided to all registrants after the session. If you have a question at any time throughout the webinar, please feel free to utilize the Q&A feature. We have a team of experts behind the scenes, and then we'll also leave some time as well to address any that may pop up. And lastly, at the end of today's session, a survey will automatically pop up in your browser. Your feedback on these surveys is very important for the development of future webinars. And by completing it, you will be automatically entered into a drawing $25 Amazon gift card. So please be sure to keep a lookout for that survey. All right, jumping into today's agenda, we are going to kick things off with the large and hidden costs of tobacco use. Then we'll talk about the modern tobacco cessation and Pivot Breathe. We'll talk about enrollment and effectiveness and why both are imperative to a successful program. We'll do a user experience demo of Pivot Breathe, and then we'll leave some time with Q&A for the end. With that, let me introduce our presenter. Joining me today, I have Dr. David Utley, founder, CEO, and president of Pivot. Before taking on that load, Dr. Utley was chief medical officer for Covidien GI Solutions, which is now Medtronic, a medical device company that develops endoscopic systems. He is a graduate of Harvard Medical School and completed his surgical training in otolaryngology, head and neck surgery, as well as facial plastic and reconstructive surgery at Stanford University Medical Center. He has over 25 peer-reviewed publications related to GI, plastic, and reconstructive surgery. Dr. Utley, thank you for taking the time to join us here today. I need a little bit of your help with otolaryngology. I apologize for that, but clearly you have a lot of passion for medicine. Tell me why you decided to become involved with tobacco cessation.
Hey, thanks, Cheryl. I'd love to tell you a little bit about that history. I want to first thank Blue Cross Blue Shield North Carolina for putting this on the agenda today, and everybody that's joined to learn about how tobacco cessation can help your employees or the clients that you serve. It's really important. While I no longer live in the Tar Heel state, I consider myself a Tar Heel. I went to elementary school in Chapel Hill, and I'm a Carolina guy. So I'm proud to be here. I consider myself, at least from many years ago, Tar Heel. I'm honored to be here. So let me just set the stage. We're going to have a really fun, fast-paced discussion today. The Q&A is open online for the team to answer questions live or feed them to me. How I started with this was I smoked cigarettes as a kid because my aunt and my mom smoked in our house. And that was the way it was in the 60s. And I grew up in a smoking society where, I don't know, 40 or 50% of adults smoked. I went to medical school and wasn't sure what I was going to do, but I'd always been thinking about, smoking and how it affected my family. All four of my grandparents and my mom and my aunt died from tobacco. And I learned that I could help patients with tobacco-related illness, which is why I trained in cancer surgery at Stanford. What you're going to see today is that tobacco is like this hidden scourge. It's a hidden health crisis. 3 times more people in the last 4 years have died from tobacco in the US compared to COVID infections, which was the health crisis of the last 4 years, of course. So let me share with you the story. And I want you to constantly think about how you as an HR benefits leader or as a consultant or as a broker can literally save lives within your populations that you serve because tobacco is the #1 cause of preventable illness and preventable death in the US. We lose almost 500,000 people to tobacco-related cancers, emphysema, et cetera, every single year. And the government and your employers and health plans pay about $600,000 or $600 billion a year in claims and costs that they don't have to pay. Where do those costs come from? 2 buckets. One is that a smoker who works for a company that is self-insured generates $4,000 in excess annual medical claims every year. And they come around mainly these 6 categories. All of these are very high in the minds of benefits leaders and consultants and health plans. Cancer, diabetes, cardiovascular disease, mental health, all of these are very intertwined with tobacco use. And then additionally, a employer who employs a smoker has less productivity from that tobacco user in the workplace, documented in hundreds of workplace productivity studies. So $9,000 per smoker per year that it costs an employer. So let's just use a medium-sized company in Raleigh, for example, that has 5,000 employees. That company has about 1,000 tobacco users, and that company spends about $4 million a year in excess health claims that they otherwise would not have to pay. So it's a big deal. Sorry, Julie. So what? I'm not sure where that. Okay. So pivot breathe. Sorry, I'm having trouble with the slides here. So pivot breathe for tobacco cessation. There's 2 really important factoids here before I get into the actual product that you have to understand, is that the government's U.S. Preventive Services Task Force grades preventive services, on kind of a rolling 3-year basis about how highly effective, cost effective, and irregular and clinically effective they are. So an example would be colonoscopy screening for colorectal cancer prevention. Colonoscopy screening is a grade A. Tobacco cessation, also a grade A. The only other grade A's are cervical cancer screening and blood pressure screening. So it's a powerful service, and employers and health plans must offer a service like this that comports with the Health and Human Services practice guideline. You can't just give people Nicorette and hope that they quit. You've got to give them a really good, strong program. And Pivot is that program. So what is Pivot Breathe? One of the problems with tobacco cessation is that half of folks in the US that smoke try to quit every year, but they do it without help. It's like trying to learn how to run a 5K without, anybody teaching you, best practices and things like that. So we bring all of the best practices together. So you'll see this in the demo in about 15 minutes, and you'll see this in the product slides, but we give everybody a Fitbit, basically, a motivational carbon monoxide breath sensor that's cool and modern and cleared by FDA to help people quit. We have a mobile app experience on iOS and Android that's rich with behavioral change content. We give everybody a dedicated tobacco trained coach for 1 full year, because when you join our program, you get support for an entire year. And that coach is yours for the rest of the duration of the program. We have a HIPAA compliant community, and we also provide 12 weeks of nicotine replacement therapy for all of our participants. So the breath sensor is the most novel. Smoking used to be the cool thing. We want to make Pivot the new cool thing. And just like my brand new Apple Watch that I love, tobacco users love getting stuff that is built for them. The only products in the US that are built for tobacco users are cigarettes. So we have this very modern mobile device that you see here on the left. It's about this big. It's the first and only medical device ever cleared by FDA for over-the-counter use in a program like ours, which if you give it to 1,000 smokers, you can triple the motivation to quit in that population that you serve. It also helps people reduce their cigarettes on their path to quitting. It helps them make quit attempts, and it also increases users' confidence. And so how does this work? So when you breathe in and inhale the plume of a cigarette, which a 1-pack-a-day smoker does that 250 times a day, because they can get 10 or 15 puffs out of each cigarette, all of those chemicals in the smoke get into your lungs and go immediately into your bloodstream. And one of them is carbon monoxide, or CO. And we can readily measure that as that smoker breathes out in their exhaled breath, carbon monoxide from their bloodstream. It lasts in their bloodstream for about 4 hours. So a typical smoker can be 30, 40, 50 parts per million. A non-smoker is going to always be less than 6 or 7 parts per million. And we color code for somebody just like red, green, yellow in any type of behavioral change. Here is a woman from Richmond who was in one of our studies that was a 2-pack-a-day smoker, which, by the way, 2 packs a day costs $7,000 a year for a smoker to pay out of pocket post-tax to maintain that habit. It's a major burden for employees and their spouses. But when Becky came into the program on the left-hand side, her carbon monoxide levels were really high, like in the 70s. And she became extremely motivated and a little scared in the first week of her program. And she quit on day 12. And her carbon monoxide levels, you can see, normalize. They go way down to the bottom, less than 6 or 7 parts per million. So what she said before Pivot was smoking was who I was. It defined me as a person. I always had crazy hair and I always had a cigarette in my mouth. After Pivot, she said, Pivot was like my new addiction. I love this sensor. And oh, it's time. I'm going to blow into my sensor again to basically to prove that she was still smoke free. Here is a user, a member of the North Carolina plan, Stephen, who quit this year. He enrolled in January. His quote, I'll just read, "This is a really remarkable device. It gives a readout of just what your carbon monoxide situation is. It's a good, bad cop, if you get my meaning. I thank it for doing for me what I couldn't do for myself by myself for 35 years. Thank you." And I think, I am not a benefits leader, but I have heard, Target is one of our largest clients. Blue Cross North Carolina is one of our largest health plan clients. The organization loves hearing that their members and their employees are being benefited by the benefits you guys all work so hard to deliver to your large population. So it's really heartwarming. All right. So Cheryl mentioned a minute ago, what do you need in a successful fill in the blank tobacco cessation program, flu vaccination program, diabetes prevention program? Everybody focuses on the effectiveness or how well the product works. What's the quit rate? Our quit rate's 30 to 40%, right? Depending on the client and the trial. What folks often overlook is you have to start with enrollment. If you only enroll 10 people in a flu vaccine campaign and you have 10,000 employees, that flu vaccine campaign is ineffective, even if you help all of them not get the flu. So Pivot focuses on both enrollment, which I'll show you, and quit rate. You multiply them together and you get the effectiveness for your company. The effectiveness is savings in dollars, higher productivity workforce, healthier people, healthier spouses, and healthier kids. Why does Pivot enroll 5 to 20 times the number of people that are enrolled in incumbent programs like Optum's Quit for Life? 3 reasons. One is the marketing materials, which we generate and then co-develop with the client or the plan. And then we often do the marketing. They are very sensor-centric, and they're very positive with respect to the voice. So you can see these examples of real campaigns that have been done with some of our clients. We also allow smokers to join our program of any readiness to quit. Most tobacco cessation programs mandate that you are ready to quit in the next 4 weeks, or we really don't have anything for you. And if you've already quit, great, you're on your own, right? We enroll people that are highly scared about quitting. We enroll them into our Learn program. They don't have to change their behavior at all. Just have to do the sensor, think about medication, talk to the coach. 1/3 of our participants that enroll are in Learn, not interested in quitting in the next year. The next step is folks that are interested in maybe reducing and learning more, but aren't ready to quit. We put them in Reduce. 1/3 of our participants enroll in Reduce. And then we have about 1/3 of participants that are ready to quit in the next month. We set a quit date and we march them through. The third reason that this program enrolls 5 to 20 times the number of people is that we enroll people that use any form of tobacco. The FDA deems vape, chew, pouches, hookah, cigarettes, cigars, cigarillos, they're all considered tobacco. And here's a little trivia tidbit. If you had 1,000 smokers in your organization, how many of them use one or more forms of other tobacco like e-cigarettes, chew, pouch, and cigars? I'll give you the 5-second pause here. The answer is 70% of cigarette smokers are polyusers, meaning they use 1, 2, or 3 forms of other tobacco. Typically, they'll use non-combustibles at work and in the truck. They use cigarettes in the morning and when they get home. Okay, so let's get to performance. We just talked about enrollment in terms of why is our Pivot program higher enrollment than others. Here's Target. We've enrolled almost 15,000 people over the last 3.5 years at Target. which is 10 times the engagement of their former product, Optum Quit for Life. Here's the Blue Cross Blue Shield North Carolina plan that Cheryl just introduced. We've enrolled 8,300 folks at that plan. They're in the fully insured book for the last 3.5 years and now expanding, as you all know, to larger books of business, which is you all. Here's the demographics of those 8,306 folks. We skew a little towards female in this particular client. You can see a wide distribution of age groups. It's not just, the 25 to 30-year-olds. We've got folks all the way up to 65. Most of these users, well, all of them are cigarette smokers, because initially the Blue Cross Blue Shield relationship with us, we had to have smokers only. We enrolled folks that poly used as well, about 20%. Now for the rollout that you guys are seeing, we can also enroll sole users of non-combustible. So if you vape only and you're interested in changing your behavior, we have a wonderful product for you. Here's how that kind of lays out. Most people, cigarettes only. And as you move out, cigarettes plus vape, cigarettes and chew, etc. Here is the engagement. 71% of the users use at least 4 or more features in the app. And then when you kind of go down to the individual things, about half of the folks pair their sensor, 2/3 order nicotine replacement, over 50% engage frequently with their coach, and 2/3 are very active in the community. So everybody's different. You've got to have something for everyone. You can't just have telephonic coaching with an operator that is a different person every time your employee or member signs up. You've got to have a holistic program with lots of choices. The quit rate in North Carolina is stellar. 26% of folks are fully quit with what we call a 30-day point prevalence of abstinence. That means at their last touch in the app or with their coach, they had not had a cigarette, even one puff, for 30 days. That's the industry standard in the clinical literature. Additionally, we have 9% that had not quit for at least 30 days, but had quit for between 7 and 29 days. And then for everyone else that hadn't had any quit, 21% have reduced by half. So these are the very granular types of data that we provide all of our clients every month or every quarter based on the reporting. Lastly, for the plan, the net promoter score, the NPS, is very high, 64. I think Apple is 50. Most health plans would love to see a 64 on their program, and most employers. And then the satisfaction rates are really high. Okay, I'm going to close up I talked to you now about enrollment and engagement as the first piece of the equation that you've got to get right before you worry about how well does the product work in terms of quitting. This is a little bit of an eye chart, but we have multiple published studies. I just showed you Blue Cross Blue Shield North Carolina's quit rates. That's in the wild, I call it, not a trial. This is a randomized control trial of Pivot versus National Cancer Institute's quit program. It's kind of the gold standard in the industry. We enrolled heavy tobacco users and randomized them 1-to-1. Okay, you go to Pivot, you go to NCI. You go to Pivot, you go to NCI. And we tested engagement, NPS, and quit rates. And I'm just going to cut down to the chase here in bold. Pivot's quit rate at 1 year was almost double that of NCI. And so you can see that you can see that at 1 year, 31% of Pivot participants versus 18% had a biochemically validated quit in Pivot. So that means they said they quit smoking, and then they blew into the sensor and had a normal sensor reading. Okay, so we talked about enrollment. We talked about quit rate. Let me just say, as a surgeon and a public health expert, to all of you that are listening, there's nothing you can do in your population to reduce healthcare costs and increase productivity that has a bigger impact than helping that population quit tobacco, period. And then lastly, we didn't get into this, but we have 30 US clients that are large health plans and large employers. We are enterprise ready. It takes us about 30 days to implement, SOC 2 compliant and HIPAA compliant. So we're it's a real deal. All right, so I'm going to take a pause and hand it back over to Cheryl.
All right, thank you, Dr. Utley. Before we jump into the user experience demo, I want to take a moment to discuss what's included with Pivot. Each enrollee receives 12 months of support, and with that comes 12 weeks of nicotine replacement therapy, or NRT, if you are familiar with that acronym floating around, the Pivot breath sensor, dedicated tobacco coach, and access to the Pivot Breathe app and community. This is all currently included for fully insured employers on the PPO network, and soon, starting 1/1/25, available for purchase for self-insured employers upon renewal. So I know that's a lot of information, and we will be distributing this presentation later this week, so you can refer back to it as needed. All right, I will pass it back to you for the demo.
Great. Thanks so much, Cheryl. Okay, so in the mobile app and medical device world, you'll often hear something called UI and UX. The UI is the user interface, and that's basically when you look at the app, like how does it work, all the things that you see. The UX, or the user experience, is how does it make the participant feel and how does it interact with them? And the way and this is just a little tech tidbit, if you look at a bicycle riding, the UI is the bike, the UX is the experience that the person gets on the bike and what that bike avails them. So we have a beautiful UI. It's modern, iOS and Android, super slick. The UX is the most important thing. So what I want to share with you is put yourself in the seat of a tobacco user at one of your clients, and this is what you're going to experience. And a lot of folks, they go right to the product. The product is part of the UX, but the first experience that I get is if I'm a distribution center employee in Raleigh at a big warehouse, the first thing I'm going to see is not the product. I'm going to see the ad. So I'm going to go into my break room and I'm going to see, wow, I'm a smoker. I've tried to quit 50 times. I failed. I feel terrible. I want to quit. My kids are sick because of me, but I've never been able to. So my employer offers this really cool thing. It's got a sensor and it's free. And then I can just do a QR code and I can sign up immediately. This is the attractant. You know, when I was in practice for 11 years, we had horrible tobacco cessation offerings at Stanford, a tertiary center. We had Wednesday evening counseling in the psychiatry building. Nobody even went. There was no scalable modern anything, and no delight factor. Part of the UX is delight, surprise. And when I say surprise, you're using this system and you feel like they made it for you because we're very customizable and we got this, this special code. So I see the marketing material that Target put out in their break room, or that Blue Cross Blue Shield of North Carolina mailed to me. And I'm like, wow, cool. I'm going to go to the web and I'm going to see language I've never heard before, clinically proven to help me build the motivation and skills to quit for good. It's like a quick kit in my pocket. So the first thing we do, and I mentioned this a minute ago, this is like triage in the emergency room. Not all patients that come into the emergency room or the primary care clinic or the surgical clinic are the same. Everyone's different. So we need to filter and ask respectfully to each person, what types of tobacco would you like help with? You can click as many of these as you want. The program will adjust for you. I am the user today. I'm just going to say, hey, I'm the smoker. I say I smoke cigarettes, and I'm going to enter a few nuggets about myself, birth date, email, name, to check eligibility. We do eligibility check right in the web portal or in the app. Boom, within a minute, I can verify my eligibility and I go, wow, Pivot is free for me. I get the coach. I get the sensor. I get pharma. I've used that before, but I never had it. I've never gotten it for free. And I get the app and I get all this community activity. Very, very cool. I'm going to create an account. And then before I get into the app, and I'm trying to explain this because I think this has been a real difficult thing for benefits leaders and employers, and to some degree health plans, is that you guys have dozens of point solutions for all sorts of really important chronic conditions: blood pressure, sleep apnea, mental health, depression, overweight, diabetes, alcohol use. So we if the client wants, we can then say, hey, in addition to tobacco use, which you're about to enroll in, you need help with any of these other conditions. And I click, yeah, sleep apnea and overweight. And I get a nice friendly message. Hey, check your inbox later. Your benefits leaders will mail you some information about other programs that we offer. So this is a really nice cross referral, and we will help. We're really good at enrollment. We'll help your other programs enroll as well. Okay. First thing I'll do now is I get started. I just go right to the App Store, or I click the deep link. I'm in. It's iOS and Android. Every 2 weeks we update it. It's very modern. I get into the app. I've already registered. So all I have to do is enter my credentials. Second triage. I already told Pivot that I'm a smoker and I don't use the other products. Now, as we explained in our enrollment presentation, we have to assess how ready I am to quit. What are my intentions? So I say, I want to stop smoking, but I have got major reservations. And I'm thinking maybe if I stop, I'll do it in the next 6 months. So this I am a perfect candidate for reduction. I am ready to change, but not right away. I'm not ready to quit. So I get put into the reduction path, right? And so the first thing I'll do is indicate that I am a nearly 1 pack a day cigarette smoker. I am given the choice here to set a reduction goal, and there's 2 variables. How long do you want to reduce? And I say about a month. And how far down do you want to reduce to? And I say about 8 cigarettes per day. All right. So the logic is going to set up a very customized program for me. It takes about 10 seconds. And then boom, the first thing I do is I turn my phone sideways. And this is what my reduction journey is going to look like. The red bars are my carbon monoxide levels. Okay, they're high. I smoke a pack of cigarettes a day. And as I go through my 30-day reduction, I'm going to get to 8 cigarettes per day. My CO levels are going to be lower, but not normal. And after I reach my goal of 8 cigarettes, Pivot will continue to work with me to further reduce my cigarettes, because reduction is not an end goal. Reduction is an intermediate step. If you can help a cigarette smoker reduce by half, you double the odds ratio or the likelihood of them completely quitting in the next year. So we use reduction by 50% as a really important interim milestone. So boom, I'm in. This is the home screen. There's lots of really cool stuff. We tour everybody through their home screen when they get there. And in the today level where it says, welcome to Pivot, why measure CO, we call that the card carousel. You get 4 or 5 cards every day that are always different and always customized. And so you look on the top left, there's my stage. I'm reducing to 8. Top right, I'm smoking, currently I'm smoking 18 a day. And the first thing that happens is my coach, my wingman, is there for me. She knows I enrolled, and she welcomes me to the program. She introduces how Pivot works, which is motivation, skills building, not all about quitting. And I'm being asked like, hey, what's worked for me in the past? How many times have I quit in the past? Okay. As I tell you this UX journey, that doesn't all happen on one day, right? So maybe on the second or third day, I am told, hey, I get a new card to learn about my carbon monoxide with my breath sensor. And again, I said before that the only product that's made for cigarette smokers is there's 2, Nicorette and cigarettes, right? That's not very exciting. And so we wanted to make this the new cool. And just like I got this for my birthday 2 weeks ago, my watch, we want the person to have an opening experience. So here I get the box in the mail. It takes about 3 days for my enrollment. It's a really cool opening experience with this modern product. Looks like an Apple Watch. I pair it to my phone. I can do a breath sample in the first 10 minutes when I get it. A breath sample takes 10 seconds. You hold your breath, you blow for 6 or 7 seconds into the sensor, and you get a reading right away. And it's red, green, yellow. 45 is equivalent to a person that probably smokes about a package of cigarettes a day. And if you notice right under the 45, it says 10 hours and 1 minute to green. And what that means is we're constantly weaving the value that they blow into an action step that they can take to change their value. So if I don't smoke for 10 hours, my levels of carbon monoxide will be that of a non-smoker. And that is really, really motivating. All right, 2 games. We've got tons of games in here, but this is called before and after. We do this in the first week. We offer, we educate the user to take a breath sample, 33, before a cigarette, take a breath sample right after the cigarette, 41. Goes up about 8 points per cigarette, depending on the person. You can see I went from 10 hours and 48 minutes to green. Now I'm at 12 hours and 4 minutes to green. So we weave that little motivational nugget into the experience. The second game is we'll have somebody sample when they go to bed after their last cigarette and right in the morning when they get up out of bed. Tobacco users, when they get out of bed in the morning, they have not had nicotine for 8 to 12 hours and they are in withdrawal. The average, another trivia question, how many minutes does the average smoker take from hitting their feet on the ground in the morning to lighting their first cigarette? At 5 seconds here. The answer is 7 minutes. And it's shorter depending on how much that user smokes. And so we weave in to, you go to bed at 10 o'clock and your CO is 35. You wake up, it's normal. It's a miracle every night. It's normal. And what we'll do, instead of having that person, habitualize and smoke a cigarette within 7 minutes, we'll have them do some practice skills in the morning. Park a lozenge from Nicorette in their cheek before they walk downstairs. Put the cigarettes in the garage. So we'll constantly try to increase that 7 minutes to 10 minutes to 20 minutes to 30 minutes. And all of a sudden, they don't have to have a cigarette in the first hour. Okay. A few days later, I'm down to 16 cigarettes. I am learning about skills. There are hundreds of interactive lessons in the Pivot program to help people build the skills to reduce and ultimately quit, because a skill-laden person has a highly resilient quit opportunity versus someone just trying to quit cold turkey. Cold turkey does not work. So I'm doing the stress module. Stress is my number one trigger. I learn about stress. I learn what the stress management and avoidance mechanisms are. We teach people how to avoid it. We teach people how to manage the inevitable stresses that we get every day. And I set a timer so that I'm actually activated throughout the day to engage in reach out to a friend if I'm feeling stressed and triggered. And then I start a challenge. So for the next 24 hours, I'm going to see how many times I can manage my stressors. Okay, a few more days passes. I'm down to 8 cigarettes. If you recall, that's my goal. And I might be a little uncertain, like, what do I do now? Right? Well, my coach is watching. My coach has me on their dashboard and they're keeping track and they're popping little tips here and there. So Laura notices that I hit my goal and I tell her, I feel great. I mean, I've noticed the number of my sensors gone down. So Laura kind of builds me up and she's like, hey, what about a quit date? You've reduced by half. Why don't we set a quit date? I'm like, all right, where do I go? So Laura sends me a link. I go into my learn, reduce, prep to quit, and I change from reduction to preparation to quit. I'm currently smoking 8 cigarettes, and I'm asked to set a quit date. This is what every program in the US asks you to do the first minute in the program, and I would have run away. I'm like, I don't want to set a quit date. I am interested in reducing though. So I've reduced. June 20th is my big day. All right, let's do it. So we leverage social media with all of the proper privacy protections, et cetera. We find that our users love posting their progress on the social media of their choice, which they can do, or our community where there are thousands and thousands of pivoters participating every day. So I get a badge. I can post that here down at Meta or Instagram or whatever, and I can post it to community as well. And my quit journey has evolved. Before I was way up at the top left. Now I'm halfway down the slide, which is awesome. My CO levels are going down and I've set a quit date. There's my goal 0 on July 1st. All right, coming back here. I'm quitting now on July 20th. I'm down to 8 cigarettes and the coach, again, he knows what's going on. And she's like, how confident are you feeling? And I'm nervous, right? And she's like, how about you do something that has worked in thousands and thousands of smokers in our program? Let's do something called a practice quit. Because just like if you're trying to train for a 10K, you don't go out and run a 10K right away. You go out and run 1K, and then you practice running 2 kilometers. And so our practice quits are set up where you set a time. And in my case, let's just do one that's 2 hours. 2 hours is long, right? If you smoke a pack of cigarettes a day while you're awake, you're having a cigarette every 40 minutes. So for me to go 2 hours is really good. And then we have to give the user lots of things to do during that 2 hours because they're going to be jonesing for nicotine, right? And so one of them is medication use. We do distraction, we do skills building, but the first thing we do is we take a breath sensor reading before I start the 2-hour practice quit. My breath sample is 41. And then we learn all sorts of things about crushing cravings. That's a thing. Most cravings last 3 minutes. Nicotine cravings, and they are awful. They're awful, different than caffeine craving, different than alcohol craving. They are intense, and they are the number one cause of people smoking. But if you get them through 3 minutes with silly little games like Candy Crush and trivia, dolphin sleep with one eye open, we have all sorts of kind of fun, snarky games. We also recommend folks utilize some of the skills that they've already built, like listening to music or reaching out to friends. Those are all really good. And then lo and behold, I get to the 2 hours, went faster than I thought. I went for a walk. My CO level is now 33 and I'm kind of I don't feel that bad. So if we can just get folks over that awful feeling of withdrawal avoidance by just lighting up a cigarette, There's hundreds of things we can do instead of lighting that cigarette. So my first practice quit, 2 hours. I'm going to post this on social media. I'm going to put it on the Pivot community board here, and I get hundreds of people saying, "Hey, great job! I did that last week." Weighing in. Okay, here's one of the most important things we do. The coach knows that you are like very close to the quit date. It's now time to learn about nicotine replacement therapy. There are 10 reasons why NRT fails most people that try it. The biggest reason is a person goes into the pharmacy and tries to pick what formula to use, what dose to try, and they have to pay out of pocket for it. It's $60 for 14 patches over the counter, out of pocket. And then there's all sorts of things about the lozenge makes somebody sick. The patches make them itchy. They didn't use it right. So we get rid of all of those obstacles by providing education and in-app ordering. So you'll see a little banner at the bottom here called NRT. We'll go there. I can order and I can learn. There's lots of FAQs in here. I can learn there's gum, there's lozenge, there's patch plus lozenge, patch plus gum, patch alone. We give all of the solutions. We also make sure that there are no contraindications, no recent cardiovascular event, no pregnancy or current breastfeeding. And then we educate on label about the proper dose for the patch and for the gum based on cigarette consumption on a weekly basis or a daily basis. So I'm picking a 14 milligram patch, 2 milligram lozenge, boom, it's ordered. It's part of the subscription. Cheryl brought up a minute ago, what's included. We will ship 12 weeks of single mode therapy to all users during their 1-year subscription. If they renew, the benefit resets, and you don't have any pass-throughs to the client or to your PBM. It's all paid for with the subscription, and you avoid having folks have to go to the primary care doc. Okay, I am really close to my quit date. I'm down to 3 cigarettes per day. I go in and I update my 3 cigarettes a day. I have been abstinent for 1 full 24-hour period, and my coach goes crazy, very, very supportive. I'm finally at the bottom of the slide, and my highest reading for my CO level that day was 5. Big event. We like to have fun, but we do it with the intention of helping people maintain their abstinence. So this is what we call the passport. And so if anybody saw Saturday Night Fever, if anybody's as old as I am, this is John Travolta dancing. But if somebody says that they quit and then they get a normal CO sample, the first thing that pops up is the dancing person and a passport stamp that you're 1 day smoke free. And I could put this on community. I can put this into social media. I changed from prepare to quit to stay quit. One more little doctor sidebar. Quitting smoking. Smoking is not a one and done thing. Smoking or tobacco use is like diabetes. It's like schizophrenia. It's like obesity. It's sleep apnea. It's cardiovascular disease. It is a lifelong condition. You cannot cut these employees and members loose. You've got to stay with them for life. Ideally, that's the way that our recidivism rate's like 3% because everybody has the skills, and we continue to support abstinence in a fun way. It will encourage you to sample every day because we'll cheer you on. You get streaks and surprises and everything on your sensor. You can post the 7-day quit on social media. This is what is this? The Carlton. This is Urkel. 7-day stamp that I'm smoke free. And it continues, just to give you, this is on Meta. And then we also have a point system. If your employers that you serve, your clients are, or if you have a point system to earn certain benefits from the HR department, we can integrate with that by giving folks points and sharing who earns the most points. And then just to kind of wrap it up, again, this chronic condition, we are going to be with the user for the rest of their subscription. If they decide to renew, because either they haven't quit or they've quit and they want the long-term support, we will be with them, right? And we will provide additional nicotine replacement therapy for slips and relapses. And we will continue to let them post to social media to show that they've been quit. So a rapid fire user experience demo. At least everybody now knows what UI and UX are. I didn't know when I started this company. So that's the one little factoid. We talked about quit rate, enrollment rate, reduction in costs, and the fact that we are enterprise ready. So I'm going to take a pause here and turn it back to Cheryl. I know we have one more section. We're going really good on time. We have one more section to share on marketing, but I'll take a pause and hand it back to Cheryl.
Thank you, Dr. Utley. Just a couple of questions coming out of that demo. I believe you touched on this, but I'd like for you to just reiterate since there was a question. Can you confirm that there is a desktop version of the program for those who don't have access to a smartphone?
Yes.
Okay, wonderful. In addition to that, do you provide education on the proper way to use NRT, gum, and lozenges?
100%. Yeah, we have to be careful. And we are a medical device company regulated by the Food and Drug Agency. So I come from the med tech world. So we will only advise we do not prescribe. We will advise a user based on their tobacco use reported on the type of NRT and the dose of NRT that are available to them, and they choose. And now if they choose wrong, we'll say that's probably not right for you, but we won't tell them what to do. So the answer is yes.
All right, wonderful. I think that's it for now. The rest we will save till the end.
All righty, and I think I'm going to touch just briefly on marketing campaigns. Dr. Utley did speak to this earlier, but marketing is super important. If we don't enroll individuals into the program, we can't help them. We've known and we've done a lot of A/B testing over the last 5+ years, the marketing campaigns that work really well, and we have kind of a standard approach to work off of, and knowing that can morph. We know not every organization has the same channels. But here's one of our sample timelines. So once again, Dr. Utley mentioned this earlier. We're trying to reach all tobacco users with the right message. So when they're ready to receive it at the right time, which is why you'll see different calls to action throughout the year. And then using a multi-channel approach. So not everyone looks at email, not everyone sits at a desk all day, so on and so forth. So this is one of our 6-month campaign plans. So we do, of course, start out with a standard launch campaign that is catered to your organization's logo. And we always recommend a 3-email approach series within a month's time. So we're not sending them 3 emails in 1 week, but we're hitting them maybe once a week over a 3-week span. And then we'll let those registrations come in organically over the next couple of weeks. We'll do kind of a mid-year campaign. It's again another 3-email series, and that's going to be spanned over a 2-month period of time. And then summer's busy. We know sometimes it gets away from individuals, so we have to remind them. July is also, I believe, a mental health awareness month, so we tie that to stress and smoking. And once again, it's a 3-email series. These campaigns are seasonal. So this is the launch campaign. It's introducing them to the program. Like Dr. Utley mentioned, it's very sensor focused, but we have tons of examples and other stock photos to choose from. And then I think just the next couple of slides are a bit more examples of that quit when you're ready campaign. So it's that non-intimidating approach. We know if we get the individuals into the door, they quit at the same rate as someone who is either ready to quit and ready to start a quit date, or if they're just coming in to learn. This is the stress and smoking campaign, and I think there's just one more example, but what you're looking at are email campaigns. These are examples of some of our flyers. If intranet ads or TV ads are most beneficial for your organization in break rooms, we also provide those assets, and they all come with a QR code. So super easy to scan. It goes directly to the proper landing page. And then, of course, we do that eligibility verification in the background.
Right. Thanks, Whit. So Whitney Oftedal is our head of client success, and she will work directly with her marketing team, our B2C marketing team, with you all, whether it's a client of one of the brokers or consultants, or with the HR leaders that are on this call. And these guys are top notch. I will just give one kind of fun story is we recognize that populations of employees are not the same between different sectors. And we have a large gold mining company in Nevada that has a very different demographic than, for example, Target's retail associates. The gold mining folks, 43% of the employees use cigarettes, and emails didn't work. So we put flyers in of all things, the porta potties that were in the mines. And we have one of the most remarkable enrollment rates at that client versus others. So we will flex with you. This is just like the triage that I mentioned. Not all users and not all populations are the same. All right, handing it back to Cheryl and I believe Jennifer.
All right, thank you, Dr. Utley. So before we jump into some Q&A, I wanted to take some time to review Blue Cross North Carolina's marketing and resources available. We have you'll see the thumbnails up over there, but we have a digital promotional flyer, which with details on the program and how to achieve success. We also have 2 FAQ documents available, one for employers and one for members. So those are both there. There is an on-demand quit smoking programs presentation, which details tobacco cessation programs available to members on their quitting tobacco journey, and it heavily features Pivot. We'll actually be distributing that in our follow-up email. Our plan management campaign features outreach directly outlining wellness programs and services, which includes Pivot. And last but not least, this webinar, which we will be sending out with a recording link and presentation in a follow-up email later this week. If you have any questions about that or about this program as a whole, you're always welcome to contact your authorized Blue Cross North Carolina representative for more details. So we do have some questions that we want to review towards the end. One of the ones that pops out, I'm hoping you can answer this. How is having a tobacco surcharge or cessation program from an HR, administrative, and legal perspective? Like, do we see any legal issues with refunding tobacco surcharges if the member completed the program but was not reimbursed for their surcharge prior?
Right. So the surcharge is one of those unusual laws in healthcare that I'm sure everybody knows this on the phone, but a employer is permitted to charge a self-attested smoker a higher premium that gets deducted from their paycheck each month than a non-smoker, and that smoker has the right, according to the federal rule, that if they join an accredited program like Pivot, even if they don't quit, they can have that surcharge reversed. And in Pivot, Whitney's team does a really rigorous job outlining what you have to do over 8 weeks. And we can report back to the employer which folks had completed the reasonable alternative solution and which ones had not. So we will be your partner in that entire endeavor.
Wonderful. Can you speak to, is there a minimum number of employees needed to participate in Pivot?
I would turn that over, from our standpoint, no. I would turn that over to Blue Cross Blue Shield North Carolina, because I think that there was 100 or more was the limit, Cheryl or Jennifer.
Jennifer, do you recall? I'm sorry, I can't remember off the top of my head.
Cheryl, I'll have to pull that information up. Dr. Lee, correct, the 100 number sticks out in my head as well. But if you just give me a few minutes, I'll pull that information up.
Sure.
Sorry, I didn't have it here for us.
That's all right. We can also send that out in the follow-up email. That'll be fine.
Yeah.
And Jennifer, actually, while we have you, or Dr. Ali, I'm not sure who would be best for this question. Somebody asked in the Q&A, excuse me, let me pull it up. Can individuals subscribe or enroll in Pivot if they're not enrolled in a Blue Cross and Blue Shield plan?
Well, the answer is not right now, but the product will be available at Walgreens at the end of this year as an adjunct to nicotine replacement therapy. And again, we've really focused just on the enterprise and health plan channel rather than having much more of a direct to consumer offering.
Wonderful. So that would work if maybe there's somebody here on the call and they're thinking of maybe a friend or somebody they know that could really benefit from the services from Pivot, but they wouldn't necessarily have that access here.
Sure.
All right, wonderful. Going through the Q&A, I'm trying to see if we have any additional questions that we may want to jump into. I can confirm, we do have our team of experts on the back end. They have confirmed that there is no minimum necessary for a number of employees needed to participate. So, Jennifer, you were correct. No minimum offered or necessary. All right, and then to clarify the question from earlier about the desktop versus smartphone, somebody wants to confirm, is the full program available on the desktop or is it just enrollment that is on the desktop?
Full program.
Full program, okay, perfect. And then
English and Spanish. So.
Oh, nice. Can this program be done on an individual basis?
Tell me what you mean by that.
I'm not entirely sure. I believe it's just if one person is interested, not necessarily to all groups, or to all members for an employer. So I believe the answer to that it would be yes.
We'll work with each client and consultant broker. However, Blue Cross Blue Shield of North Carolina wants to organize that. We'll work to try to accommodate folks because we've done some creative contracts that in smaller businesses where they buy a certain number of seats, and so we don't want to discriminate, but we have to also abide by what the Blue Cross Blue Shield of North Carolina plan is availing to us here.
Wonderful. I think that is actually it for our Q&A at this point. If there's anything that pops up afterwards, feel free to respond to the follow-up email after this, and we'll get you connected with somebody that can answer any outstanding questions that we may not have been able to get to.
Can I say one quick thing, Cheryl? Just one last 30 seconds. So let me you can unshare the screen if you want to, Julie. So I'm just going to speak to everybody as a healthcare provider. And this is the one chronic condition in the US and globally that you can all be healthcare providers in intervening on this chronic condition that has a 55% mortality rate. And I've given a talk before where I've got a bunch of engineers in the room and I've said, hey, how many of you have been in a situation where if you weren't there, someone would have died? And usually it's only firemen, policemen, nurses, doctors, the healthcare role, right? Or maybe a good Samaritan CPR person. If you can help get a robust tobacco cessation solution launched at your company or at the companies that you serve as a consultant or a broker, you can tell your kids or your spouse or your friends that you're saving lives. Because this is powerful stuff. It's like pulling someone out of a burning building or operating on a cancer and saving someone's life. So I just want to leave you with that little emotive nugget. Very important stuff. You guys were super generous with your hour today. Thanks for listening. You guys can always reach out to Pivot if you have any questions, but Cheryl and Jennifer and the team will be the filter for everybody. Thanks.
Wonderful. Thank you for that. With that, I want to thank everybody again for joining us. Please keep a lookout for our post-webinar survey for a chance to win that Amazon gift card. And our August 27th spotlight will cover our various diabetes programs offerings. We're still finalizing those details, but I will go ahead and drop that registration link in the chat if you would like to go ahead and put that calendar hold for you. Dr. Utley, it was a pleasure having you join us here today. I hope everybody has a great rest of their day, and we look forward to seeing you again. Thanks all.
Thanks a lot. Bye-bye.